Good afternoon, Peter Goertz. I'm a psychiatrist. I'm on call this weekend, so I want to tell you a little bit what it's like to be on call as a psychiatrist. And it's wonderful. I'm just kidding. I'd rather be at the beach, but you can still enjoy being on call. And whether or not you enjoy being on call depends to a large extent on your intention, your attitude, how you approach things. As you know, the way you walk into a room, that can in a major way affect your interactions with whoever else is in that room. So you want to watch your intention, you want to focus on doing things in a way that you can enjoy yourself, even being on call. And the top priority being on call, and with any medical work, is safety. So the top priority is safety of the patient, safety of the staff, safety of yourself. So you want to do your best to ensure that. But right after that, the next priority, in my opinion, is to enjoy yourself. So you even want to enjoy being on call. And to help you enjoy being on call, you want to be efficient so you don't stay longer than you need to stay. So you want to delegate tasks as much as possible. You want to get out at a reasonable time, get out of work, and be able to have some balance in your life. And the way it works with me is I'm on call with a resident, so a junior psychiatrist or a psychiatrist in training. So if necessary, you want to separate tasks. So you can do one thing, the resident another thing, or you can see one patient, the resident another patient. And that in itself right there saves a lot of time and makes your life easier and also more enjoyable. So it's more efficient to delegate, separate, see patients separately, if possible. And the way it works for me is I'm on call at night 3 times a month, and that is just covering the emergency room. So I stay at home on those nights, and the resident can call me anytime during the night or during the day even while I'm at work, and tells me about emergency room patients who come in, and we talk about them and decide what needs to be done. And one important thing is with the resident, with staff in general, with nurses, you want to stand your ground. So if there's a situation where the resident feels the patient is not dangerous, can be discharged from the emergency room, but you feel otherwise, or you feel the resident needs to talk to someone else, like a family member, an additional family member, and make sure the patient's safe to leave, you want to stand your ground. So, and especially if you have a gut feeling that patient is not safe to be discharged, you want to stand your ground. And even if that means arguing with the resident or the nurse or whoever it may be. So that's my night call. I do not have to, rarely do I have to go in during a night call because the resident's there in the hospital. Now, when I'm on call weekends, that's from Friday morning until Monday morning. And on Friday, I'm at work anyway. Then at night, I take the usual night call. And then Saturday and Sunday, I do have to go into the hospital. So I see the patients on medical surgical wards who need psychiatric consultations. And in general, the resident sees those patients, and I additionally see the patients, and then we talk about them and decide what needs to be done. And sometimes, like I said, we can separate. I see one patient, the resident, another patient. And generally, I don't have to stay a whole lot of time on the weekends. I try to get out by around noon. So I go in around 8:15, try to get out by noon. That doesn't always work. But in general, I do not have to stay until 5 o'clock. So in general, it's not a full work day at the hospital. Now, afterwards, when I get home, I do have to check the notes that the resident wrote in general. So there's additional work that you have to do at home, but at least you don't have to stay at work all day. And so covering the emergency rooms, what we see are patients in general. They call us about patients who are dangerous, may need to be admitted to a psychiatric hospital. So that's suicidal patients, homicidal patients, psychotic patients who may not be able to function in society, patients with extreme anxiety or severe anxiety, patients who are using alcohol or drugs and incapacitated or withdrawing, demented patients who are having problems with agitation or just not being able to take care of themselves. delirious patients, so confused patients, which is usually related to a medical issue or a drug or a substance like drugs or alcohol. And we also, during the day, on the weekends, we see consultations, we see patients on medical and surgical wards, and they can have the same issues that I just mentioned with the emergency room patients. But in addition, they more often are confused or delirious than the emergency room patients because they have medical issues, they've been through operations, they have pretty serious medical issues that can contribute to confusion. They're on multiple medications often. And an additional issue that comes up on medical or surgical wards is if a patient has the capacity to make decisions for their own medical care. And often they don't. If they're, for instance, confused, they don't even know what day of the week it is, what month it is, etc., then they're not in a state of mind where they can make decisions for their own medical care. So that's another question that's often asked of psychiatrists who are on call covering medical or surgical wards. Now, again, we want to focus on balance in our lives. We want to enjoy ourselves at work and outside of work. So while you're outside of the hospital and on call, you want to make sure you can hear your phone ring or your beeper go off. So if you're in a loud place, you want to set the phone or the beeper on vibrating so you still notice if you're called or paged. And you want to avoid alcohol, of course, because you want to be alert when people talk to you about patients. You want to make sure you get enough sleep if at all possible, so go to bed early if necessary. And your wife or husband or children, friends may try to make demands on you, but you want to set boundaries so you're relaxed and have enough time to attend to your work. And if you do want to spend time with friends, family, your wife, etc., then sure, of course, do that. But if you don't really have the time, if you do need to do some work and cannot, let's say, go out with your wife for dinner that evening, so be it. I mean, that can happen. But in general, my on-call days are not so bad. I can go out with my wife for dinner. Thank you.